It is good to be here. I am Erie County Executive Mark Poloncarz, and we are in Buffalo Public School 45 to make a very important announcement about the upcoming school year, as well as what, of course, is needed for parents to have their children in public school in the upcoming year, as it is in every year. I'm joined by our Health Commissioner, Dr. Gale Burstein. He'll talk a little bit more about this as well, and you'll hear from her, as well as Dr. Sharon Brown, the Buffalo Public Schools Chief of Student Support Services. We are joined also by the UB School of Nursing's Dean, Dr. Annette Wysocki. Dr. Wysocki here? Yep. Yes, okay, that's what I thought. Dr. Mai Nguyen, Buffalo Public Schools Director of Social, Emotional, and Wellness Services. You'll hear from Dr. Nguyen as well. We're also joined by Dr. Melinda Haas from the UB School of Nursing, Jacelyn Samilski from the UB School of Nursing. We are joined by what was called Dr. G, Dr. Jennifer Gorlius, the principal of PS 45 here, as well as a few others, including our Erie County Department of Health Director of Health Equity, Kelly Wooford, and Mrs. Tina Jones, the Buffalo Public School Assistant Superintendent of Supportive Services. You're probably wondering why we are all here today when we have the County of Erie, Buffalo Public Schools, and the UB School of Nursing together. Well, I think as most people understand, to attend public schools, children have to be vaccinated with the required vaccines from the New York State Department of Health. You must have your vaccines by September 17th, otherwise your child cannot participate in school activities, including the educational or any sports afterwards. What we've seen, and Dr. Burstein and I have talked about this over the last couple of years, is there's more and more children who are going to public schools that do not have their required vaccines and therefore are not allowed to continue in public schools until they've been vaccinated. So much so that recently, over the last few years, actually for quite a long time, Erie County Department of Health has been assisting parents in getting their vaccines for their children if they do not have them. It's gotten to such a point where the Erie County Department of Health cannot do it on its own. And it's important that it gets done as a community-wide effort. Today is actually an important day because in the history of the Erie County Department of Health, because it's the 78th anniversary of the Department of Health's first board meeting. So here we are 78 years after the first Department of Health board meeting, and we are still dealing with issues that they were dealing with back then, which is ensuring that children are vaccinated to ensure that they are protected from illnesses that can take their lives. Here in Buffalo, in Erie County, we believe in science. We trust the medicine. We understand the vaccines that are being provided to children have been tested over and over and over and are safe. We do not believe or read just something that a quack wrote on the internet and don't vaccinate children. But unfortunately, that's what we're seeing, is that some parents are deciding not to vaccinate their children, which is putting them at risk for illness, as we've seen. There's been measles deaths in the United States this year, including for children. And others, especially our new Americans who are immigrating to our country, may not understand the requirements that exist so that children do require to be vaccinated to go into public schools. And because of the increase in the number of individuals, for whatever reason, children who are coming to classes or arriving at school without proper vaccination, we are partnering together between the Erie County Department of Health, the Buffalo Public School District, as well as, of course, our friends with the UB School of Nursing, to offer 4 vaccine clinics at upcoming Buffalo Public Schools so that these children can receive their vaccines, can stay in school after the September 17th deadline. I want to thank our partners here who made this a reality. It took some time to ensure that this could be done properly and that all the issues would be covered. But I do want to thank our friends with the Buffalo Public Schools and the UB School of Nursing, especially the UB School of Nursing, for taking on this responsibility, which for many years had been a portion handled by the Erie County Department of Health. The Erie County Department of Health is not going away. We're still going to be providing vaccines as necessary. But it's gotten to a point where we need partners to ensure that every child who should be vaccinated is vaccinated. And that's why I'm very pleased that we have entered into this partnership. And it is a partnership between Erie County Department of Health, Buffalo Public Schools, and the UB School of Nursing, to provide these clinics. The clinics, of course, will be in Buffalo Public Schools, but the clinicians and the individuals who will be providing the immunization will be the School of Nursing from the University of Buffalo, with some oversight from the Erie County Department of Health. So this is an example of how we work together to protect the public's health. As I said, there may be issues in other parts of the country, but here in Buffalo and Erie County, we trust the science, we trust medicine, we trust the clinicians, and that's why we're ensuring that to protect children from diseases that can cause significant health risks or death, we vaccinate them. And I want to thank everybody for being here today to ensure that we are protecting the most precious asset and resource that our community has, the children. With that, I'd like to turn it over to Dr. Sharon Brown of the Buffalo Public Schools, Chief of Support Services, to talk about how it's going to work in the Buffalo Public Schools, these 4 clinics. Dr. Brown?
Thank you so much, County Executive Mark Poloncarz, for all of your support. And this is definitely an exciting day. So good morning, I am Sharon Brown, Chief of Student Support Services with the Buffalo Public School District, and I bring you warm greetings from our newly appointed Superintendent, Dr. Pascal Mubanga, and I'm joined today by 2 valued members of my team, Mrs. Tina Jones, who is the Assistant Superintendent of Student Support Services, and Dr. Mai Nguyen, who is the Director of Social, Emotional, and Wellness Supports, and she also oversees district-wide comprehensive nursing. And the BPS team collaborated with the Erie County Department of Health as well as UB School of Nursing, and they work weekly with our BPS medical directors, doing everything that they could to ensure that we are expanding resources for our students. And certainly our heartfelt to Dr. G and her team for hosting us here today, and also for being so gracious to host one of the vaccine clinics and to be one of the sites. And speaking with her today, she is absolutely thrilled, and she's excited to be able to open her doors as well as all of her other BPS sites. And also, every student, as was already mentioned, attending schools in New York State, including those students in Buffalo Public Schools, must receive all required vaccinations to attend classes. Families, we appreciate you so much. You do so much to keep your children healthy. And staying up to date with vaccines is certainly a critical and vital part in that effort. And we appreciate the support and the collaboration, and we want to work with you so that your child can start the school year and be supported for his or her education. And also, we want you to know that if your child is not fully vaccinated, please register to buffaloschools.org or consult with your healthcare provider. Children who are not fully vaccinated, we understand that they have less protection against serious illness and may risk spreading to others who cannot be vaccinated. So let's continue to work together as a team. We've seen over the years with the hard work of our BPS team where our numbers are trending in the right direction, and we're seeing less and less students who are not up to date with their vaccination. So once again, Buffalo Public Schools, we are so proud to collaborate with ECDOH and UB School of Nursing to further support our families. And thank you so much for everything that you do. And now we are going to turn this over to Dr. Gale Burstein, who is the Erie County Commissioner of Health.
Thank you. And a pediatrician. I love vaccinating. So, and I'm happy to be here today, and I'm thrilled to be working with our Buffalo Public School and University at Buffalo School of Nursing partners. And I'm also happy to recognize Kelly Wolford from our Office of Health Equity, who is also here today. So as our county executive mentioned, for the past few years, we really struggled to make sure that all the Buffalo Public School students and all school students entering K through 12 are up to date with their immunizations. And I know that families, sometimes they have some challenges making sure that their kids are up to date with the required vaccines so they can stay in and stay healthy. And so with this joint effort that we have, and we also want to reach out to other school districts if you're watching, and if you want to contact us for some help with immunization at your schools, we're really happy to do that. But we are so glad to partner with our Buffalo Public Schools with our maiden launch of this initiative. So I just want to point out that so much of the public health work occurs behind the scenes. So having the opportunity to a public event like this to shine a spotlight on our work is really value. When everything is working, you don't hear much about us. It's hard to prove that vaccines are working when no one sees cases of polio, pertussis, or measles walking around in Erie County. And as the county executive mentioned, vaccines are one of the safest, most effective, life-saving innovations in our history of histories. Diseases like polio, tetanus, measles, and diphtheria have become incredibly rare due to this widespread vaccination and coordinated efforts like this project. I used to see a lot of chickenpox earlier in my career as a pediatrician, and now that illness is rarely seen. Diseases like measles only have supportive care available for treatment, so there is no medicine to cure measles, and we have seen deaths, unfortunately, in the past couple years. For people and parents who want healthy kids, vaccines are a really simple choice. Community immunity is crucial to protect those who are vulnerable. That means children too young to be vaccinated, people who are immunocompromised because of conditions like cancer, and pregnant people. And I know that parents and caregivers are bombarded with health messages. Some of those messages are designed and delivered by bad actors. Misinformation is powerful, insidious, and ever-present, and it undermines public health principles and established science. Whether the reasons are for profit, for chaos, for power, the results are the same. Everybody is left more exposed to vaccine-preventable illnesses and some terrible consequences, from being miserable at one end to lifelong injury and death at the other end. In our current political climate, some of the loudest voices are some of the least informed. So lost in all of this toxic rhetoric is the fact that most families want to vaccinate their kids. And just last week, the CDC reported that New York State's kindergarten vaccination rate is 99.7%. And so that of kindergarteners. So that's 99.7% of New York State kindergartens are vaccinated. And that's because of the strong laws we have that require children entering K through 12, whether at public schools, private schools, parochial schools, they all have to be up to date on those required vaccines. So in light of this turbulent time, our department remains committed to vaccine promotion and access. It's more than just good science, it's the right thing to do. So as a message to parents and caregivers, we're still a few weeks out from the start of school. So check in with your child's healthcare provider to see what screenings and immunizations are needed based on their age. Those child care checkups are essential for identifying potential health issues, especially vision and hearing issues and developmental delays before they become more severe. And as an opportunity for parents to ask questions, have any fears concerned that are addressed. So just welcome you to make those appointments with your pediatrician, get vaccinated, and have a great start to the school year. And so now I am going to invite up our UB School of Nursing Dean, Dr. Annette Wysocki.
Thank you. We are delighted to be here with our community partners to support this effort, both the Erie County Department of Health as well as the Buffalo Public Schools. And we recognize how important this is to protect the health of our youth and our larger community. Local health today is global health, and global health is local health at a time when disease can be spread from just one person away or one plane ride away. It's so important for our community. As the most trusted profession, have more direct contact with people than any other members of the healthcare team, making our partnership with the Erie County Department of Health and the Buffalo Public School System essential to public health efforts like this. Our students will be helping to carry out vaccination efforts here with our partners, where they'll be working under the direct supervision of experienced faculty to administer these vaccines. This work will provide real-world experience for community-based care while ensuring the highest standards of safety. It also helps our students to build essential clinical expertise and communication skills and experience firsthand the role that nurses have to play in keeping children healthy in our communities and together with our partners to prevent and create more accessible care to our community and prepare the next generation of nurses to lead in public health. We cannot be more delighted than we are today to be a part of this partnership, and we look forward to continuing to sustain this effort in our community. Thank you. And now I'd like to turn it over to Mai Nguyen, Buffalo Public School System Director.
Good morning, everyone. Thank you for being with us. I'm excited to have worked in collaboration with Erie County Department of Health and the UB School of Nursing. We've been planning this for a couple months now, so we're really excited to offer the first vaccination clinic this Thursday right here at Buffalo Public School International School 45. And it'll be from 10 a.m. to 2 p.m. And you can pre-register on the buffaloschools.org website. Or we are accepting walk-ins as well. So we're really excited for this first of 4 vaccination clinics. Please check the website out for our other 3 dates. Thank you.
Thank you, Dr. Nguyen. For the record, so we have it for our friends from the media here, we will also be offering a vaccine clinic on Thursday, September 12th at Buffalo Public School 95 Waterfront Academy, 95 4th Street. Wednesday, September 18th from 2 to 6 at Buffalo Public School 309 East Community High School at 820 Northampton. And Thursday, September 19th from 2 to 6 p.m. at BPS 363415, the Louis J. Bennett Middle or Early College at 288 Main Street. As Dr. Nguyen said, you can get the information on those on the website. I just want everyone to understand that we are unfortunately in an environment, as we know, where it wasn't that long ago vaccines weren't political, but they've become political, and they shouldn't be. And all you have to do is look at the average lifespan of an American at the turn of the 20th century compared to what it is today. If you look at the average lifespan of somebody who was born in 1900, they were not expected to even make it to 60, as compared to today where it's over 80. Why? Because of healthcare and vaccines. The diseases that killed so many young children because of vaccines. There's a lot of false information out there. If you look at the evidence, the medical evidence, the scientific evidence, vaccines save lives, they protect people, and they do not cause ill harm. There's a lot of false information out there. And we want people to understand that we're here to provide the vaccines that can save your children's life, at least prevent them from having a serious disease. We're here to help. That's what we do in Erie County government. That's what they do in the Buffalo Public Schools, and that's what they do at the UB School of Nursing. We're very pleased to be here today to offer these 4 vaccination clinics. We hope that parents will take them up. And remember, if they don't, if your child does not have its vaccine by September 17th, they will not be able to continue in school education or sports or whatever it might be, and you'll have to homeschool them. So make certain that your children are vaccinated, make certain they're up on their immunizations, and we are here to do that at no charge to the public. With that, we'll entertain questions from the media if there are any.
What are understanding the exemptions for New York State? Because it's obviously a medical condition. Are there any religious exemptions as well? I'm trying to remember what the state put in place, because it seems like in 2019 something changed.
Sure. In 2019, New York State revised its laws for required immunizations in school. So non-medical exemptions are not allowed. Only medical exemptions are permitted for students to not be required to receive certain vaccines. So example, say a child is immunocompromised they're being treated for cancer, they still want to attend school, it's really important. So they would not be able to receive any live virus vaccines like the MMR. That's why it's very important for the community to be a cocoon around them so that we're all immunized, we're all protected, there won't be any measles, mumps, or rubella infiltrating our community because we're all immune. There won't be any person for the measles virus to hook onto because we're all protected. So that's the only exception, only medical exemptions by a licensed physician. Thanks.
Any other questions?
Just one quick one. And I know a lot of people are wondering about the COVID-19 vaccine that's still required to come to school.
So there is no longer a COVID-19 vaccine requirement for school attendance. Still, we strongly encourage all parents to, to go to their healthcare provider and get their kids immunized against COVID-19. We still see terrible complications among children of COVID-19 infections, and we still see hospitalizations. We still see other complications, and we don't want to. So this is a vaccine preventable disease like flu, like any other vaccine. So we strongly encourage parents to get their kids immunized and themselves immunized. Thanks.
Another question.
Sure.
The measles, it's still a concern in the community. Could you talk about measles and what that looks like here in Erie County?
Sure. Well, as I said, 99.7% of our kindergartners are up to date with vaccines. That includes MMR. So we're fortunate we do not have any measles cases and have not had any measles cases for years in Erie County. However, that measles are breathing down our neck. There have been other cases in New York State, including in central New York. There are cases in states surrounding us, so we have to continue to be vigilant and get everybody, make sure everybody who can be immunized is immunized. If you have the vaccine can only be received by children 12 months and up. So children under 12 months cannot get vaccinated against MMR. If people are traveling to areas outside the United States or even inside the United States where they see more measles, then children between the ages of 6 and 12 months can receive a measles vaccine, a first measles vaccine, but doesn't really count into their vaccine series because it's their immune system isn't mature enough, so it won't be long-standing. So they'll still have to receive their other 2 measles vaccines. But fortunately, again, I think it's because of our high immunization rates. We have not seen measles in our community. We still invite healthcare providers. They're still calling our epi office with suspected measles cases, and we've been working with them to rule those out. Unfortunately, all those cases have ruled out as being other causes of rashes. But we are on the lookout. We're being very vigilant because measles is very contagious. If you're in the room with somebody who had measles, you're considered exposed, and there's a strong likelihood you'll get infected if you're not immunized. If you walk into, say, a grocery store where somebody had been there who had active measles, within 2 hours, you're considered exposed. Measles is that contagious is that somebody in the room within 2 hours, you can still be exposed because the measles virus are floating around for as long as 2 hours and leaves. So it's very, very contagious. It's among the most contagious communicable diseases, and we really want people to be immunized. Thank you.
How much damage has Robert Kennedy caused with his anti-vax efforts between the ingredients of them and the statements he makes? Have you talked to other folks that are really believing in all of this?
I'll briefly address it from a governmental standpoint. People are now pointing to what Robert Kennedy says as proof that vaccines don't work or vaccines can hurt people. And I'm not a doctor, neither is Robert Kennedy. When you talk to the doctors and they're like, he doesn't know what he's talking about. He's wrong. The sad part is you can find anything you want on the internet today. If you want to find something that supports your bigotry or racism, you can find it on the internet. If you want to find something on the internet that supports your own personal anti-vax views, you can find it. But the facts and the science proves otherwise. So that's why I kind of said earlier, we believe in science, we believe in medicine, we don't believe in what some quack wrote on the internet here. And I think it's important for people to understand that. Parents have a choice. They can either put their child in a public school, a private school, a parochial school, and be vaccinated, or they can homeschool them. But all you have to do is look at what happened in Texas earlier this year. I mean, I think it was a 5-year-old child died of measles. There's no child who should be dying of measles. Dr. Burstein noted in central New York, there was a measles case. There was measles cases in Ontario, just north of us. We haven't had one, but every week I get a weekly report from the Department of Health, and it identifies major things that are concerns. And a lot of times it's been, we have a suspected measles case. We have a suspected measles case. I'll get the next weekly report saying that was ruled out. If things continue as they are, eventually we're going to get a real measles case because someone was not vaccinated and put at risk someone else. And remember, it's not just about you, it's about the greater community. Because if you're not getting vaccinated, you may carry that illness and you may infect someone else who may not be able to get vaccinated because of an immunocompromisation issue, they're going through cancer treatment, and then you put that individual at risk. So just, if you want to see, just go to my Facebook page and see the comments to my Facebook posts about individuals who are truck drivers or electricians who are then saying that they know better than the entire scientific community. And oh, by the way, Robert Kennedy supports them. I don't care if they're a Democrat or Republican and independent. I don't care what their name is. If it's Kennedy, Trump, which are two of the most biggest names in politics, if they don't know what the heck they're talking about, they shouldn't be advocating for one thing or another. And Robert Kennedy doesn't know what the heck he's talking about when it comes to this. If anybody wants to add anything after that.
Does the school district find a lot of challenge with international, just trying, get through those language barriers and explain that this is required?
So we have a phenomenal multilingual program that helps support our students and families that are coming from other countries. So at each of all of our immunization clinics, we'll have translators available, understanding that there is that need for that. I know Dr. G and her team has been working with what we call the language line, and so making phone calls to families that don't have English as their native language. So we try to meet the families where they're at, and a lot of the reasons why we chose this school and this community is because the need is there, but also supporting them with language interpretations, having the interpreters here. A lot of our paperwork is translated as well. We have over 100 languages within Buffalo Public Schools, and we try to translate our flyers and our robocalls in the top 10 languages in the district. So we do what we can to support our families and meet them where they're at.
And if I could note, our Erie County Office of Health Equity has concerted efforts to go into communities where there are new Americans, individuals who may speak a different language, and inform them about, here's what you need to know, especially about vaccines for your children. So I want to thank our director, Kelly Wooford, and her team for doing that. If you go to any community day on the west side of Buffalo or east side of Buffalo, you will inevitably see our Office of Health Equity, and you'll see all the pamphlets they have in the different languages, because we want individuals to know that these are the requirements if you're going to put your children to school. Also working with the agencies that do exist, the International Institute, Jewish Family Services, Catholic Charities, Jericho Road, and the rest, so that when they get a new patient or a new individual in the community, including organizations that represent the community, like the Karen Society or Burmese Society, that those folks are educated that here's what a new resident, a new member from your community needs to know and we will put them in touch with someone who speaks their language so that they can have a better understanding of what's necessary. And truthfully, in the last couple of years, one of the reasons that we're expanding this clinic is we're seeing a lot of immigrants, legal immigrants to our community with their children, not understanding that they need to have these vaccines to actually put their children in school. So it's not as if the parents don't care about their children and didn't want them to get vaccinated. They just didn't know about the requirement because it wasn't required in their home country, but it is here. Any other questions? If not, I want to thank everybody. I want to thank the members of the UB School of Nursing who will be administering the immunizations, starting, as was noted, this Thursday. For more information and to register, go to the website, as we talked about. Let me just make certain I say it right. buffaloschools.org for more information and to register your children for the upcoming vaccination clinics. Thank you, everyone.